Oh, well, certainly I would like to see some regulations enacted. I was very disappointed that the climate bill has been tabled and that we've lost that momentum to do what should have been done long ago, which was to control CO2 emissions and develop a really sound energy policy that looks to the future, clean energy, and with all the benefits that that would bring. So of course that was a great disappointment, just happened. I would also like to see reform of toxic chemical legislation, because we have not had in this country a preventive approach in the sense of requirements for testing, thorough testing of chemicals before they are produced and released to the environment, often in large quantities. And we should follow the example of the European Union, which put in place such a policy called REACH, to register and require testing of chemicals, where the burden is not on the public or on government agencies to show that there is a risk, usually after the fact, in fact almost always after the fact, but the burden is on the manufacturers to show that their chemicals are safe. If there's any word that I treasure more than any other, it is prevention and the need to prevent disease. There are glimmers of hope. The Lautenberg bill has already been introduced in the Senate, and there is another bill in the House that is, I understand, is in the works, pending, that would take important steps toward that kind of toxic chemical reform. I think the problem has been on both sides. I think we have, as scientists, not been good communicators, not been clear and told stories clearly about what it is we've found and what the meaning is. We also haven't always provided meaningful advice to parents, caregivers, say, on how they can, what steps they can take in their own homes, in their own lives, to take control of the situation and have more protective environments for the children. In other words, avoid the use of toxic chemicals in the home, certainly avoid smoking in the home, prevent that from happening, ensure that children have healthy diets and so forth. We need to give out that information in a very clear and helpful way. And we do that in our newsletters, which are bilingual, Spanish and in English, which and also with magnets for refrigerators and other informational forms that the mothers and families in our study appreciate. They say they've been very useful to them, and we also are sending those to our community partners for dissemination through their various avenues. We also disseminate the information on our website. So we're doing our best to get that information out, but also to get out the information about some of the involuntary exposures that we have seen effects of, including air pollutants, which require policymakers to take steps. We understand from getting feedback from the city government and from other levels of government that our data have been helpful in promoting better policies, say with cleaner buses in the city, and also restrictions on idling of diesel trucks, on cleaner diesel fuels, and individuals who are opposing siting of polluting sources in their neighborhoods. And we've worked very closely with West Harlem Environmental Action. They're our lead partner, community partner on this. They have used our data as, along with others of course, but to advocate for prevention of more pollution in their neighborhoods, and cleanup and safer alternatives to transportation in the city. So those are the things that we've been trying to do. But in most cases, we had to learn how to do that. We had to learn how to do that better, and we're still learning, because most scientists don't know the language and don't know the media and the ways to do that. And so we've been very helped by our partnerships with community organization, and have been very open and dedicated to sharing our information so that it is helpful at all levels, the individual, the family level, and also at the policy level. And we consider that as important as doing our rigorous research. But of course, without the research and the rigor of our research, which is hugely, very demanding, requiring people from disciplines, every discipline you can think of, epidemiology, pulmonology, immunology, biostatistics, risk assessment, and so forth. Without that, we would not be able to provide the information and give the stories that need to be told. The problem is with the way that the public is getting information. It's just short bullets, and there's no sustained, flow of information that would help them to understand the importance of the problem and to know what they could do about it and to become engaged. I think often there's a sense of fatality on the part of the public. Well, it's too big for them to do anything about, but that's not true. So we need to tell stories about how individuals have become engaged, community groups have become engaged, and using scientific data, they have been able to successfully advocate for change. And I can cite a number of local community groups as well as national groups that have been highly effective. The Natural Resources Defense Council is one, and I should say that I'm on the board of that organization. Environmental defense, and others have been so effective in taking scientific information and translating that into forms that policymakers can use.